Facial rejuvenation is what we call making the face look younger. It's done by doing one of several things, either working on the eyes, the neck, or the skin. These three details are what people pick up on when they look at you. It's human nature to compartmentalize and guess what someone's age is. However, we'd like to make that a little more confusing. So by addressing the skin, we're essentially treating it with either laser therapy or a good regimen for skin care. We could do non-invasive treatments such as fillers, neuromodulators like Botox, to take out wrinkles and heavy expression lines. Skin resurfacing can tone the skin, firm it, decrease pore size, and improve the appearance of wrinkles, as well as the color. Eyelid surgery is performed to freshen up the eyes. Again, people are looking at you when they speak to you, they look at your eyes. So eyes are such an important part to looking youthful. Lower eyelids are treated with either PRP, laser, or removal of skin or tightening muscles. The upper eyelids are treated with removal of skin, essentially to freshen and brighten the look. As it pertains to the neck and lower face, these are deep tissues. Typically require surgery. Which surgery is going to be best will depend on where your trouble area is. If your lower face is smooth, your jawline is smooth, and you have a very limited collection of skin strictly under the chin, sometimes a non-invasive procedure called a cervicoplasty can be performed. This is where skin is removed directly from your neck with an elliptical incision, and then we do zigzag cuts to kind of break up that scar to make it much less visible. It's a surgery that takes typically 1 hour, done under straight local. You'll have a surgical tape and a suture line that will remove the stitches at 1 week. The downtime is minimal, you're back to your routine in a very short period of time. A facelift is going to be necessary if there's laxity in the lower face, downturning of the mouth, jowls appearing, loss of the jawline, and the angle between the neck and the jaw. This is done by lifting the tissue and repositioning it in a direction back and up. It's really the way the skin falls. It falls forward and down, so reversing that direction is how we can rejuvenate it. It's very important that we make the face look very natural. Over-tightening in one area will give away signs that you've had a facelift. And really the stigma as a facelift is when we see someone walk past us at the grocery store and it causes us to react. The good quality facelifts are passing you every day and you never even take notice. And that's really the point of a good surgery, is that it looks natural and gives you credit for your own appearance. Incisions for a facelift are typically performed through the temporal area, in front of the ear, under the lobule and back into the groove, and into the hairline. Staples are used in the back as well as in the front, and very delicate sutures around the ear. It's really retailoring the skin around the ear in a much natural and conspicuous way that makes for a quality facelift. The tension has to also be very evenly distributed. We can't have the neck really tight and leave excess tissue in the lower face, and vice versa. So essentially, no different than making your bed. You don't pull at one corner of the sheet, tethering the sheet. You lift the sheet and you smoothly remake the bed. By undermining certain areas, we can re-elevate the skin flap and make it look seamless and very natural in how it fits around the ear. And that gives you a nice, youthful result. A quality facelift should take maybe 4 to 8 years off of your age. Any more than that will typically lead to a tethered, unnatural appearance. And you always have that for the rest of your life. You will always look those many years younger at whatever age you become. So it's not a result that just goes away. The downtime of a facelift is usually 1 to 2 weeks. Pain is minimal. Most of my patients are off pain pills by the very next day. There may be a drain tube for 1 to 2 days underneath the neckline. You elevate and ice for those first 2 to 3 days, and then maintain elevation when you sleep for up to a week. All sutures and staples in the scalp area are removed by 7 to 10 days, and you're back to public presence within 2 weeks.